Colleague at TPI, Janet Alexander, has helped me to understand how to train the female athlete differently. She put me on to Dr. Wendy Sweet to help answer my questions on how to train menopausal women. So please make welcome to the show, Dr. Wendy Sweet.
Thank you so much, Charles. It's such an honour to share some of my work with the viewers, especially those women who are heading into their midlife hormonal changes, which we know of as our menopause transition. It's an age and stage that can be really confusing for so many women, especially those who have done a lot of exercise over the years and become disheartened when they don't see the results that they've seen in the past. So perhaps if I explain to your viewers a little bit about menopause, because when it hit me, I had no idea why my body suddenly had a mind of its own and why my exercise performance went out the door. So basically menopause is the opposite of puberty. When we go into the decline of estrogen and progesterone, this signals in the end of our reproductive capability. So what we're doing is we're going into the next phase of our life, which is our aging.
Wendy, as a coach and as a man, I knew next to nothing about menopause and its effect on sports performance. Do you think people like myself, coaches and fitness trainers, need a little bit more education and information about this?
Yes, absolutely, Charles. We need more information. We are a generation of women who actually know that exercise is good for us, as we're the first generation to have government health promotion messages ingrained in the education system when we grew up. Besides, as my research also supported, women use exercise to help them cope with all that they've got going on in their lives. But most importantly, from the perspective of healthy aging, because there is no education about this life stage, I think a lot of health coaches and trainers just extrapolate exercise prescription messages from younger demographics and athletes into women in their 50s. Which actually begs the question, who's defining healthy aging? Is it the fitness and sports industries with messages that resonate with athletes? Or is it the media with images resonating with masters athletes? Because most women I know are not athletes. They are busy bringing up a family, looking after aging parents, working. They've got a lot going on. So lack of time is still a real issue for them. But from a physiological perspective, as we transition through menopause, we're actually losing the role of estrogen and progesterone. So in a low hormonal environment, there are numerous changes to our heart muscle, liver, joints, blood vessels, and our heat regulation mechanisms. So this isn't being taken into account in exercise prescription. Then because many women put on weight, they end up being on nutritional plans that are probably better suited to athletes rather than their changing liver and cardiac health as they lose estrogen. What's more, larger women have a risk for heart disease as they age, whilst thinner women have more risk for bone density concerns, which is known as osteoporosis. So depending on a woman's body type, it's really important that she gets a balance of cardio, strength, and relaxation and stretching exercise as well. But of course, you know, as we all know, exercise must be meaningful to women, so they do it. And it's important for trainers and coaches to understand the lives that women want to lead as they get older. Do they want to be strong and flexible for golf or skiing or hiking? That's the question that should be guiding exercise prescription.
Wendy, some of my clients have complained about dizziness. We all know that balance is critical to perform well in sports, but is there a connection between balance and menopause?
Yes, absolutely. In fact, I found myself that I couldn't do my step classes or the rapid twisting and turning in the exercise to music classes that I'd done for years. It's got a very technical name called benign paroxysmal positional vertigo. And this happens when we lose estrogen because estrogen helps the tiny hairs in our ear canal to stand up. And if we don't stimulate our balance, then feeling dizzy all the time can affect our lives and our exercise. Falls are the number one problem in elderly women. So one of the things that women need to begin learning from midlife is to do more exercises which actually stimulate balance, gait and stability.
Balance, gait and stability. Now I can see why. Wendy, does this information have relevance to women who aren't athletes?
Yes, indeed it does, Charles. And I think that the most important factor that impacts on women in midlife, whatever they're doing, is their lack of sleep and feelings of anxiety. Both are related to our high pressure lives, intersecting with our hormonal changes in menopause. So when we aren't sleeping, this increases heart rate, blood pressure, temperature, and our chronic stress hormone called cortisol. When cortisol is higher than normal throughout the day, then this impacts on our nervous system as well as our insulin or blood sugar regulation. Our nerves are full of estrogen receptors, so when women have careers whereby they have to make rapid decisions, and nurses and doctors come into this category too, then our nervous system becomes overstimulated. Add to this the stress of the job and not sleeping, and you have a cocktail for worsening symptoms such as anxiety, hot flushes, night sweats and more. So women need to be on their game with being able to balance up their high pressure jobs with the right downtime, relaxation, the right type of exercise, and of course stress management techniques as well. When women are feeling the physical effects of sleep deprivation and menopause hormonal changes, then they must slow down their thinking and learn strategies that help them cope.
That's great information. Thank you so much, Wendy.
Thank you, Charles. It's been great.
For those of you out there who have never thought about the connection between performance and menopause, well, there you have it. But you know what? This could also be life-changing information for all those women out there who are struggling with menopause symptoms. Thanks for tuning in. I'm Charles Pan. If Charles knows why, so do you. See you next time when we discover more secrets of high performance.